Good afternoon, everyone. I'm Maha AlZahrani, and I will be moderating today's session, inshallah. We hope it will be a beneficial and informative session for everyone. First off, I'd like to start by introducing Alfaisal MedHub. Alfaisal MedHub is an initiative under the umbrella of the International Office at the College of Medicine of Alfaisal University that aims at creating an online global community of medical students and covers a broad range of topics, and had multiple sessions that were posted on its YouTube channel that you could check out. We are excited to bring to you a webinar of the Career Guidance Series, KSA, regarding applications from the lens of a program director, which will be given by Dr. Fadiah AlKhattabi. Throughout the session, you can feel free to send in your questions on the chat, and we'll have the last 15 minutes left for questions, inshallah. With that, I'd like to introduce our guest, Dr. Fadiah AlKhattabi, who is an assistant professor at Alfaisal University and a consultant general pediatrics and child abuse pediatrician at King Faisal Specialist Hospital and Research Center in Riyadh, Saudi Arabia. She is also the Pediatric Residency Training Program Director and Internship Program Coordinator at KFSH and RC in Riyadh as well. Please go ahead, Dr. Fadiah. Thank you for being with us today.
بسم الله الرحمن الرحيم. السلام عليكم جميعا. طبعا it's my pleasure to be here. Thank you Alfaisal MedHub, and thank you for Alfaisal student. Majority of you my students, so I'm very proud to see you around, organizing a similar event just to help the applicants through the next step, which is the interview, inshallah. طبعا congratulations to all the applicants they received yesterday. I think a good news. It's a big news. You should celebrate with your family, with your friends. This is a great achievement you reach now, and this is the first milestone in your career. So إن شاء الله بإذن الله موفقين منها للأعلى على قولهم، وإن شاء الله بإذن الله يعني you get all the support and you'll be the next generation, the future pediatrician, which is you're going to lead the pediatric world in the future, inshallah. طيب, and I'm going to share my presentation, inshallah. Okay. بسم الله الرحمن الرحيم. And inshallah, يعني majority of the question I hope we can answer during the presentation. I know the time is limit. I know you're thinking a lot. طبعا before we start this, يعني usually just calm down now. As I said, you achieve and it's a big achievement for you all. So it's a first milestone, and it's going to be after that inshallah التوفيق والنجاح. So وكلوها على ربكم وإن شاء الله بإذن الله you will do great inshallah for interviews. It's another step, and maybe just you need few tips and preparation. We'll talk about a few things, and you may have few knowledge about the pediatric residency training in Saudi. Bismillah. So I will try to cover all those things in a very short, in a summary way, like educational system, the admission process, the selection criteria, the training centers, the Saudi, the common mistake, the tips, the pediatric residency, the training, the duration of the training, the structure, the learning opportunity, the evaluation, on-call duty, expectation, and promotion. So if we talk about the educational system, طبعا first thing in Saudi, you know, the internship, and then you move to the first year residency, and the second year, and then the fourth year, third and fourth year, and each one of those years, it's contain, it's contain 13 blocks and almost a year, but this is the structure. The pediatric residency training program consists well-structured, full-time, supervised 4 years of training after the medical school. So after you complete the internship, you're going to go through the 4 years of training after the medical school. And then the fellowship training, inshallah, after you finish your residency training. The admission process, and I think a lot of you knows about the application. So you create your profile, you're building a strong portfolio. That's what you did. Verification, score, GPA, SMLE, portfolio, program selection. You choose your program and you choose your region. And the second thing, the nomination. The matching system as an automated method in Saudi, and then you get all the results through the website, and you get the nomination. Then after that is the acceptance. So you do the interview. That's what the next step, I think, all you're going through. And then the ranking order, the list, you do that. And also the program director, they do that. So the applicant rank the center rank the applicants also. Matching between the candidate and the center will be made, and then the result of them and through the matching day, and the result will be available in the Saudi Commission website. The fourth step, the registration, and you start to pay your fee for Saudi Commission for the registration. You enroll in residency, submit your requirement professional classification, submit the internship certification, submit your sponsorship if it's dependent on the center and where you're going and where you're enrolled, if you're sponsored, if you're not sponsored. And then the hiring process. So now there's another move. You're not medical student anymore. You're an employee doing a training under supervision and also doing some service. So you're an employee, you're providing a service for patients. So the program director will notify the academic and training affairs. The academic and training affair will notify and submit your requirement. Guidance will be from the academic and training and the human resource also management. So there was like one of the things about best centers in region and in the kingdom, and this is you. And I look at it from 2 points. It's depend on the people that are enrolled in the residency, the structures of the program, and the level of the graduate, and what's their impact in the society later on. So setting a top of ranking the best center in the region and then the kingdom vary upon the percentage of the graduate attending the training center and their score in the major exams also. So the percentage of the final and the first part exam. Best center and to help you informations about choose higher, less training centers, structures in the training program in Riyadh, for example, King Faisal. Maybe that's where my heart goes. So where's my home is. So King Faisal is considered as one of the leading program director in the kingdom. King Fahd Medical City, King Fahd National Guard, King Saud, the Prince Sultan Military Medical City, Security Forces, and there is a lot of programs. Even if they started recently, they're also doing fine and they're going in the right track. Then the selection criteria. So the priority for Saudi, you know that, and then after that, there's few exceptions in a few centers, and but to know just to be that deliver that information. That's in a majority. That's the Saudi nationality have the priority. And then the graduate from accredited medical school with an MBBS or equivalent degree, MD, successful completion of medical internship, passing SMLE Saudi medical license exam, passing the interviews conducting by a different training center, the recent letter of recommendation, research, and publication. You add in your paper and on a CV also the workshop attending, the life support courses, the conference attending, the CME by Saudi Commission, conference attending as a speaker. Some of you impress us sometimes in the interview. Either you presented a poster, presented talk, appreciation letter from my university, from the dean, from the program director, you were best intern. So all those things, it's also important to list it in your paper. And the recommendation of the letter working in subspecialty in the last 6 months. So for example, if you did the pediatric in the last 6 months, it's good to list all those recommendations. Very important thing, and if I'm going to talk a little bit in a pause here about the interview and what we're looking in general. So definitely all those things that where you're ranking, the GPA and your CV and all those things. And I think we'll talk. And if you have any questions, we'll explain more. But to tell you the truth, I'm us and doing this for a couple of years now. Behavioral, it's and how you behave during the interview. It's reflect a lot how you will behave with patient, how you'll behave with your colleagues in the future. So sometimes try to be aware what I know it's a nervous situation sometimes for you, and some of you maybe this is the first interview, but do a small practice with your colleagues. It's a nice practice to do it together. That's fine. And just prepare yourself. Don't be in shock during the interview, and don't be overconfident. Come on, it's not any good. You're here just to show how you're good, confident, safe physician also, a good communicator, and people they can work with you in the future, because the knowledge and everything, it will be you will gain those things in the future. So behavior is most very important thing. The confidence during the interview, your response to the questions in a way. If you cannot understand sometimes the process, the questions, that's fine. There's a few tricks, like you just repeat the questions or ask the mentor, the people, the interviewer to repeat the question for you, but just respond to the questions and answer only what they ask you. Okay. What's your expectations? A good candidate versus a right candidate. It's usually it's all together, and a good candidate, they're usually the right candidate. Background verification, personal qualities and abilities. That sometimes even in your recommendation we can't tell about those things. So selection of applicants, as I said, like during the interview, and I think majority of the program directors, they're looking for that. So some percentage about medical knowledge, we can get that from your qualification, from your degree and everything. And then sometimes we're asking you short scenarios, and we'll see, and sometimes it's unfair and then just to get that knowledge, but at least I want to see how you're processing the thought and how you're dealing with the thought. So medical knowledge, a level of clinical skills, also what also exactly procedure you did, all these things, it's in your CV and your achievements, GPA. Unfortunately طبعا بس يعني just to be honest, you're here كم دحين 90 صاروا ولا كم الحضور. GPA, we look at some, it's one of the things, it's mandatory to look at it, but also I look at all those things. Yani if it's not working, I don't care. I don't look as a program director. And to tell you the truth, the majority, it's one of the things it's give us, you're a hard worker, medical student, you achieve, this is achievement. لكن ما تكون هي بس solid things, okay? So and sometimes some of the interviewer they omit this and they don't want to see this, and we know like it's not all the time reflect and a good candidate and a right candidate, as you said, but it's also important, and it's some of the you just it's your achievement. You did something different than the other, and you worked hard and you achieved that. Level of experience, if you have as a medical student attachment in some area, that's also it's good. Research, publication, and also like you have to be prepared during the interview. So what research you did, what is your role in that paper? Some of you in the interview, like they don't know about the paper itself. They didn't have a clear role in the paper, so that's not good. So you have to identify your role, what you did, how's the paper, and who's your mentor, who's the group you worked in, and discuss the paper a little bit during the interview. So you have to be careful about that. And then your academic performance, interpersonal communication skills, and professionalism. Common mistake, let's just talk about that. So asking for rescheduling interviews, sometimes if it's not necessary and we think like, guys, you're not interested or you're unorganized from the beginning, it's not really a good unless like you have a valid reason. Asking for the result immediately after the interview and keeping anxious, that's like not. Some of you sometimes, and I notice sometimes when talking about other program directors, like just that feedback, they're following aggressively, they want to know the result, they're nagging. So I'm sure you will not do that, but rarely it happens, and it's usually against you guys. Okay. And the common mistake, usually not following the instructions. So please attach the following document and stuff. So the people, when they ask you about stuff, just listen to the email carefully as it was sent from the center, what exactly they want from you. Because if your paper it's missing, we cannot review your paper before the interview. It's not good. Usually that's not present you really well. Like, and we're missing a lot of paper. It's a late submission, deadline, and then those things. So be familiar with the training program. It's good to ask about the center you're going to do an interview. So ask about the training center before you're doing the interview, the environment, knowing your skills and qualification, prepare response for common questions. So what exactly they're asking, you can ask your colleagues. I saw one of, I think last year or the year before, I don't know, like there was some interns there, they summarized already the most important questions and from each center. So I was laughing when I saw that, because the program directors, they change, people, they change, but that's good. If you think like centers, they keep their questions, and people they're asking, but you have to be, the most important thing, you have to be familiar about the training programs you're going. How to approach the clinical scenario. Thought it's very important. As I said, like the most important thing, I want you to be a safe physician. Most of the program directors, they want to reach that, they're responsible, they're safe physician. So to translate that to me during the interview, even if you don't have the right answer, if you didn't answer really right, you don't have that knowledge still, but at least I can see like your thought, you're processing the thought in the right way, and also you're a safe physician. I think everybody attending today, it's a pediatric group. So what is pediatric? So pediatric, and we'll talk maybe, and it's bring a lot of emotion for me when talk about pediatric. When I choose pediatric, I think I was a 5th year medical student, and I know at that time, I want to do pediatric for many reasons, and we'll talk about that. So it's relating a branch of medicine dealing with the vulnerable population, so the development care, disease of infant, children, and adolescent. The profile of the practice of pediatric, it's a subspecialty deal with the health promotion and prevention. And that's why I did child abuse as a fellowship. So working in a prevention and advocate for patient, and detect and management of physical, behavioral, developmental, mental, emotional, environmental, and social problems that affect children. The ability of communicate effectively with patients, families, and social services professionals is the key to provide effective pediatric care. I think we talked about the residency training. So the duration, as we mentioned, 4 years. This is, I don't want to overwhelm you with this. This you'll see, inshallah, once you're enrolled in the training program. So this is the structures. It's the training from a Saudi commission, and those the requirement for each year for the junior level and for senior level, and you have to complete this every year through the 13 blocks. Teaching and learning is structured, and the programmatic more responsibility for self-directed learning. So first thing, we'll talk about the practice-based learning, PBL. So that's you can see it in the program, in the morning report, in the clinical conference, case presentation, choosing a good case, reviewing with a mentor, discussing that, and you prepare the presentation and you're reviewing the case thoroughly. That's one of the learning opportunity you get during your residency. Afternoon activities, protected time, have academic day, journal clubs, mortality and morbidity, quality indicator, hospital ground round, attending that also. Core educational program, it's including formal teaching and learning activity, universal topic, core specialties topic, and trained selected topic. Evaluation form, you're going to see that you'll be mandatory to do the lookbook and the procedure logs and everything is attached into the electronic system 145, the in-training evaluation report. And then now the Saudi Commission, they're going in a direction of just depending mainly on your monthly assessment, your performance, and your evaluation, and continuously assessment, and instead of just doing a formal exam at the end of the year. Many clinical evaluation exercises. Also, this is one of the things you're doing during your training, and it's in a small exercise you do with a mentor, reviewing case, reviewing physical examination or procedure you did, then you discuss the case with the mentor. Average on call, that's by the Saudi Commission, and there is a lot of talk about changing this to shift and night float. So probably you would not see this anymore, but this is what's mandatory, and this is what's happening in the most of the center. So the 4 years, what we're expecting from you to place an enhanced resident competence in. Taking history, physical exam, approach and management, differential diagnosis, managing an acute and chronic illnesses, a good communicator, and gaining a lot of interpersonal skills, and also provide an education and experience that prepare the resident to be a competent general pediatrician. So when we graduate you from the program, we want you to be a competent, safe general pediatrician at the end, able to provide a comprehensive coordinated care for a pediatric patient in the future. Expected level of competency of the core specialty level problems. So take a focus histories, and so there's a lot of subspecialty also you're doing during your rotation. So taking a focus history, triaging and prioritizing the patients. As I mentioned, knowing the chronic and emergency management, generate the most likely diagnosis, focus on differential diagnosis, describe the pathophysiology, the clinical anatomy of the condition, and doing order, interpret the appropriate investigations and the management, counseling the family, caregiver, also recognize the secondary complication, adverse event, the severity, manage the complex psychological, financial, behavioral aspects of the condition, teach students, you're being supervised by fellows, colleagues, and other mentors, and regarding the condition. The promotion, now the criteria for promotion, it's depend on the scientific committee, it depends on the regulation we get from the Saudi Commission. So that can be changed from year to year. So for the junior, R1 and R2, and for example, mandatory thing, the communication course certification, and the simulation course and training evaluation report, many clinical exercise, objective structures, OSCE, also the things that to assess their knowledge, the resident, instead of the promotion exam. Now the continuous assessment, the knowledge plus new journal of medicine, and then they have to do 500 objectives each year. And also you're required to do a PLS PAL, to join the next year the PICU. From and then for R2 and R3, you do the basic clinical research as a second year. You have to get certification, and in training evaluation report, many CX, OSCE, and also the Knowledge Plus, and you have to be promoted from R2 to R3, pass the Saudi board part 1 examination, and then research project as a senior. Before you finish the program, you have to have a manuscript written, and you have to go through the research process from the proposal, submission, getting the RAC to get the research project in training evaluation, and also the final OSCE in the final board at an R4. And then you'll join the fellowship after you passing the clinical and the written exam. So at the end, and then I conclude my slides, knowledge it's always power. It comes with learning, and skill comes with experience. Experience create an attitude and expectation. Your attitude will determine your attitude. So please remember those things. So if you have any questions, I make it short. I don't want to talk a lot about the structure of the program, all those things. You will hear this during your journey, during the 4 years. So.
Allah يعطيك العافية, Dr. Fadiah. Thank you for the informative presentation. You gave a great overview of the pediatric residency in Saudi Arabia, highlighted the important parts of the application. So thank you for that. We haven't really received any questions from the audience yet. However, we do have a list of questions that we had prepared and would like to get your input on. Just to start off, regarding pediatrics, and what would you say are the pros of being a pediatrician?
So, anyone to choose the pediatric to be subspecialty today, I think they will love to answer that question. But for me, and I usually I'm being an advocate for those vulnerable population, working with whole family. You're not only working with the child, working with everybody in the family, the child. That's also bringing joy to me. Seeing them healthy. This is the next generation who will help everybody in the future. So they're being healthy, physically and mentally, and well nourished. That's our goal. So it's the science itself also. It's a beautiful science. It's if you love it from your undergrad, you will continue loving reading about pediatric disease and each subspecialty. That's one of the things, and also the experience itself. It's a wonderful, and it's always good when you see them healthy after their analysis. So that's.
Definitely. And I think it's very satisfying to see them just grow throughout the year, especially if you're following them for a long time. Exactly. All right. And so our next question would be, some people would argue that pediatrics is going to become saturated as a field in the main cities in Saudi Arabia within the next 3 to 4 years. But what are your thoughts on that?
It's an excellent question, and it's the answer of this. It's a huge, and then just we can talk for days about this. There is a lot of national movement aligned with the vision of 2030. So either from the Saudi Commission or from the Ministry of Health, dividing the cluster, distributing the physician. And I can reassure you that there is still a huge need of pediatrician, and I don't think so. We reach that still. That's just a simple answer, but there is a huge national work and effort about that. Just working on a good distribution, serving our community and pediatric. But
All right. And now, when it comes to the applications and evaluating the applications, what would you say is the most important aspect of the application for you and program directors in general? And what kind of things do you find are red flags?
The most important thing is the quality of the information you provided. So the quality is better than the quantity. So exactly what's the quality of the information you're submitting to us, okay? That's the short answer. So usually think about everything you're submitting and how's the quality of that CV, how's the quality of those certificates. The red flags, if there is a gap in the CV and the dates and stuff, so that's a little bit like if you don't explain what's exactly was going on during those gaps, we'll questioning what was happening, and that's like usually. Sometimes maybe it's by mistake, but it's a little bit. It's give the interviewer and the program director uncomfort, like if there is an inconsistency between the CV and the certificate. So if you're not matching everything, you're not going with those small details, it's not good. So usually you have to be careful about that matching the time and the consistency in your CV.
So would you suggest that everything that would be included in a person's CV should have a corresponding certificate or proof to it?
Sometimes the CV, it's in the beginning, it's fine, especially we don't have to have a lot of paper. If they ask you the center to download everything, download it, send it as a PDF, one file, that's fine. Then online, they're looking for that, but to bring it handily, no one will look at it. So if you download everything, that's one of the things, it's good.
Okay, all right. And you kind of touched upon this already, but regarding the exam scores, including the SMLE especially, and clerkship grades, for example, within pediatrics, and how much does that matter when evaluating an application?
So as I said, we take it all as one package. It's not, we cannot divide that. But this is very important. As I mentioned, GPA, that you're a hard worker, you did a lot in medical school. So you achieved, this is a kind of achievement for you. And the other thing, it's give me a little bit for the medical intern, the ability to be a competent for their job. So they study the SMLE, they're going to do fine in their exam in the future. They will be a competent and for their job. So that's one of the things we will highlight on it. But as I said, we take it all. For me personally, I think the majority of program directors, one package. We cannot divide.
All right, great. Now, when it comes to the CV, do you have any suggestions or regarding the do's and don'ts for the CV?
Usually provide the information that's in the to do, like that's more achievement based. So you achieve this thing. So that's a good thing to add it to your CV. Usually try to emphasize the experience that can be applicable for the residency training you're applying. So all the things related to pediatric, add it, show it, let your CV to speak. Oh, you're dying to get the pediatric residency. I think that's happened already in the matching with the things you add to their score. But try as much as you can, it's specialty oriented a little bit. You can add things extra you did, serving community, you worked with other, and it's not surprise. I can tell from the CV, and many times an applicant, they told them, you won in ophthalmology before? That was your first choice? And there's no shame on that. That's fine. Yeah. But I can tell from their CV, they don't have an interest in pediatric. So don't make it like this. Like you can a little bit, like just especially after the matching, and if you're still seriously coming to the interview, you're thinking about pediatric. Some of them, they were thinking about cardiology, but at the end they get the match and not in medicine, they get in pediatrics. So they went through the pediatric residency and they did the pediatric cardiology, and I know them personally. So So don't try to hide a lot of information. And the other things, also try to just to let your CV speak about your interest. Okay, so that's the most important thing.
I definitely think being honest and truthful, about things is really important, because I think it's easy to tell when someone isn't.
And just whatever you're trying to do, just the majority of the program directors are expert, the interviewer, it would be obvious. So just to try, even about the things, extra curriculums, for example, or something, the hobbies or stuff. Don't lie about things, like don't say a lot of things. It's fine, I love, but we will interested to know this is a part of you as a human. But don't mention fluent in French and you don't know a single word and you cannot say a sentence. Okay, that's give me a lot about honesty and integrity and stuff. but one time there's an interviewer who is fluent in French, and he was like starting to ask the applicant, she doesn't know anything, so he doesn't know anything. So
Okay.
so
that's not a good situation to be in.
Exactly.
All right. Now, when it comes down to research, how important is it in an application, and is it important to have a publication? Is that a must?
It's already in your score, صح, Maha? It's already something to add point there. So that's one of the things to tell you how much there is weight on it. It's usually when I review applicants, they have 3 publications, they've been in a co-author, they participate, they can talk about the methodology of that paper, what is their role, how they help the mentor, what they did exactly. It will be different than someone who didn't have any experience and who didn't work on anything. It will add a lot of value, definitely, and how they will be interested in future research. So it's important if they have it. If they don't, it's not also something fast. They will not get accepted in any center or anything. But as I said, it's something that will add value to their CV, definitely.
Definitely. All right. There are some questions that are coming in, so I'll go over a few of them. Someone is asking whether language, if a person's English isn't great, and is that if it's not perfect, and would that be a reason for not getting accepted?
Not really بصراحة, بس أنا بقول لك يعني it's one of the red flags a little bit. يعني I will assume you will be fine in a level of average, below average a little bit, because you study in English, all of your medical school, صح? فat least يعني you will be an average in the language. It's not أنا ما أبغاك perfect ولا ده, بس at least يعني you will communicate. In healthcare and the medical field, you're going to deal more with nurses, with the other healthcare provider. They're not speaking Arabic, so you have to master the language. And you during your study during the residency. بس يعني بصراحة يعني ما هو شيء مرة ملاحظ, بس يعني I have a lot of students, they really improved during the residency, definitely. يعني with the practice, they enroll in courses themselves, afternoon, after working hours, and so on. They want to improve their language. يعني انتوا your young generation, you're the future. يعني حتى لو أحد يعني الإنجليش ما كان مرة ممتاز, أتوقع إنه انتوا يعني everything in your life دحين بالإنجليزي. فما يعني يمكن generation قديمة هذيك هذوليك اللي يعني كانوا struggling, دحين مع open social media everything. You can حتى improve your English وانت في البيت, مو لازم تحضر يعني courses في center أو تحضري في مكان. بس definitely يعني it's one of the things we look, بس ما هي برضو إذا الأشياء الثانية كويسة ما.
Alright. تمام.
يعني.
Alright. Now someone's asking, in what's the difference between a recommendation and a reference from an interviewer's point of view?
Well, it's both. It's the same. طيب, and I just it's the same meaning at the end. And for the reference recommendation, the most important thing بالنهاية فيها the content of the reference of the recommendation. I don't care if you bring 10, 20. But if I see a few names and I see the content, it's really good describing you as a candidate. That's something we care about. So I don't care if you bring me 20 or 30 or some of the rest, trainees, interns. They collect a lot of recommendation of reference letter from someone. Sometimes the reference letter أحيانا يعني what they mean by that, I give you my email, people they can communicate with me later on. That's one of the things as a reference for you, and then if they want to ask about you in the future, so that's one.
All right. And someone's asking if in the CV, and should they include only their references, or do they include the recommendations as well?
As I said, everything. It will add a value. It's related to the subspecialty you want to join. That's amazing. Okay, so you can add everything, but make sure it's relevant to what you're applying for.
All right. Okay. Also, no, regarding someone's asking whether there is a cutoff for the GPA in certain centers, and is that true that there is a cutoff for their grades?
Yes. Yeah. There is a cut of GPA and the majority of the postgrad and ATA. But I think I reviewed the list quickly, so I think you're fine as a group. But I need to look at it. I think you're okay. يعني ما حدا فيكم كان وصل الكتا. yes, I think yeah. طبعا في سنتر هم في بالهم number معين they do for a certain number. أنا I do for everybody interview, just to tell you the truth. يعني I give a chance for everybody. طيب, well, that's your right to get the chance. We can during the matching when we submit the list, we can reject from our list around 20% from the names. So it's dependent on the program director. Some of them the GPA, one of the things, the attitude, many things. They're not interested in pediatric, whatever the reason. So we have the authority to do that.
Definitely. All right. Now, regarding the letters of recommendation, do they have to all be from pediatricians, or is it fine whether they are from people outside of the field of pediatrics?
It's fine, but it will add more value لو مثلا قلت لي حطيته الدين حق الجامعة مثلا أو كان the postgrad مثلا someone in the ATA, someone in the academia, someone it's not يعني صح إنه ما هو pediatrician but also in educational field, so that will be يعني a chairman of the department مثلا of the surgery, بس أنت you're applying there بس إنه they like you, you're very active, you're doing that. يعني زي ما قلت لكم, it's not by the number, it's by the content and what's in it, and because we talk about your professionalism, your punctuality, your communication, your attitude with your colleagues, all this it's important for us. I trying to add the other recommendation letter, but maybe it's better if you look about the people, that will add a value to my CV. Okay.
All right. Now, do you have any advice for applicants that have gone unmatched, or la samahallah, that are going to be unmatched at the end of the application cycle? And what should they do to improve their odds during the upcoming year?
طبعا يعني احنا نقول ايش دائما لكل جواد كبوة, صح؟ it happens, it's life. مو كل شيء دائما يجي على هوانا, not everything يعني زي ما نتمنى, وده كلها توفيق بيد الله سبحانه وتعالى. إذا ما أعطانا إياها هذه السنة بيعطينا إياها السنة الثانية بطريقة أحسن وبشيء ثاني, و still you get match, we get the chance. Maybe you get the chance to think about the subspecialty. Maybe you get the chance to improve the way how you present your thing regarding research, recommendation, rotation حقتك, you get attachment to a clinical service in the same area you're interested in. Next time you want to get match in camp for pediatric, try to work on research, increase the research, and add it to your CV during that year. So adding all those things that will improve your score definitely. وbelieve me, يعني أنا شفت كثير, يعني صارت الناس ما توفقت أول مرة, بس next time they get mapped, they get higher score actually. You know, they collect their hard during the year.
Yeah.
As they say, decisions doesn't determine the destiny, صح? فإحنا we have to open our thought, our heart, accept that. Okay, it happened. خلاص, that's what happen this year. Next year أنا حشد حيلي أكثر وخلال هذه السنة أشوف لي mentor. يمكن هذه الأدفايس أكثر شيء. Try to find a mentor. Try to find someone can guide you during that year. ما تقعدوا لحالكم كذا. Try to get an opportunity research, clinical service, attachment, work خلال هذه السنة إنك أنتوا يعني to improve your score as I mentioned.
كله خيرة.
أيوة مش آخر الحياة. طيب that's
كله خيرة.
لها challenges we all كذا لازم الواحد يعدي فيها في الحياة. طيب
صح. Who someone is asking if you did mention that the priority is for Saudi citizens during the applications. However, is it possible for residents or muqimin يعني for them to get a residency position in Saudi?
I think if they get a sponsor, or some of the center, they provide them with a sponsor, and they get يعني acceptance later on. بس أتوقع إنه they need to get that center to sponsor them. So that's the most important thing. It's depend on the center to tell you the truth. بس يعني عموما generally حتى في centers هذيك يعني they give them a limited seats also. But there is center definitely accepted non-Saudi.
Okay, tamam. And someone's asking if they should add or could add all of the electives that they would have done if it was not related to pediatrics in their CV, and if they did an elective in ER or surgery or whatever it is during the summers, and should they add that to their CV or would that?
Yeah. Anything you did, that's okay. That's fine. But يعني هي الفكرة بس أنا مو إنه ده بس يعني مو الفكرة مثلا السي في كله يكون سيرجري وحتى الإلكتيف والروتيشن everything and new research and then nothing in pediatric. طبعا إذا صارت وبعد الماتش that's fine. You can say that. يعني you can say you were being interested. That's the second match or that's the second choice and that's it. بس بالعكس be honest present. يعني أنا عندي كثير كانوا they did ENT, they did derma. أنا I did derma one of my elective, so it's fine, it's okay. طيب my elective I want to do whatever I want. طيب it's okay, it's not يعني شيء you have to hide it. لا definitely.
Tamam. Also, there was a question about, is it fine? Do the letters of recommendation have to be from the same year? And if people have letter of recommendations from the year prior, from when they applied and now they're reapplying, could they just use the same letters of recommendation from then?
They can, but it's better to be updated صراحة. يعني they can use it, it's fine, but it's better يعني خلال last 6 months, 1 year, it's better in the same year usually. We prefer it.
Okay. And regarding the interviews, and usually what's the average duration of the interview?
بس عشان قبل ما so sometimes the applicant before I forget Maha, they can ask the same person يعني just to update the date if they worked with them for a year, for example, we still they're working with them وده, so they can يعني بس it's better to update the year مع المنتور نفسهم, so they can approach the mentor. So your question about
the interview and the average duration يعني of the interviews.
Not more than 20 minutes يعني maximum وصل 30 minutes يعني either they have something they want to find still in the interview they didn't understand from you, but usually 20 minutes يعني that's the average.
Okay. Well, we are getting specific questions يعني about KFSH
عادي we can.
فما أدري إذا تبين نتطرق لها.
Yeah, definitely.
عادي. Okay. So someone is asking if KFSH would sponsor يعني the residents to go for residency or fellowship abroad.
طبعا abroad. Okay. طبعا it's depend. طبعا if you're an A student to start, you start a couple of months impressing the people and there is a vacant position. There we have a couple of يعني people they join for example cardiology and they worked with them during the intern. It happened يعني عشان ما أكون يعني غير صادقة. طيب usually we don't prefer people يعني to go like this يعني either to go pre-scholar before joining the residency ولا بعد ما يخلصوا residency. But in the middle, if you get the support from us and we find like, yeah, you deserve to go a scholarship, and the other the section they want to send you and there is a specific criteria from postgrad also from the ATA. So if you fill all that, definitely you can get a scholarship. Yep.
Now, does it matter if a person did not take an elective or rotate in KFSH, or let's say within a certain center, and does that affect their chances of getting accepted in that program?
لا عادة يعني احنا we know يعني during the internship عدد السيت محدودة, how many one were accepted in each block, into your majority of you have you're along to the university. الuniversity تعطيكم أشياء mandatory to go through a certain hospital. So we know sometimes there is difficulty to come to our center, we understand that, أو to other center. بس أهم حاجة إنه يعني your CV, everything, your personality, the interview went okay. Because the interview, by the way, حتى احنا when submitted to the Saudi Commission, it's depend on the ranking we do, and we depend on the grading. We grade you during the interview also. So if you're doing fine, and if you are in a couple of residents, if you're aware, you can ask them. They didn't join us before. They didn't have the chance to join us. But their paper, it's okay. They're excellent during the interview. We prefer people they worked with us. طبعا at least يعني ايوه انه يكون يعني شفناهم عرفنا their personality. بس لا, definitely we'll give the chance to other. Yeah.
الله يكتب الخير للجميع يا رب. هو إنه there was also a question. I missed it. Just 1 second. And no, does the university, the applicant graduated from hold much weight? Yani, does it make a difference from what university they came from?
A tough question. على يعني أحيانا سبحان الله أنا دائما أقول لهم أنتوا يعني تضروا بعض, أحيانا تفيدوا بعض. طيب فأحيانا some of the applicant they get a bad experience على الجامعة نفسها اللي هم graduate فيها, they reflect badly. But we understand sometimes it's not the university, it's the applicant. هذا الإنسان كان ما هو كويس, بس it's not the university. عادة لا, غير إنه مثلا لو لاحظنا مثلا during their يعني recommendation حقتهم ما هي كانت قوية. إذا we heard from other people إنه مثلا لا, ده الباتش الجروب اللي متخرجين من جامعة معينة ما كانوا their top interns مثلا في مستشفيات معينة. those information ترى get transmitted ترى ما يعني احنا we know. طيب من الباتش هذا كويس, هذا الباتش لا, هذول كويسين الجروب ده. it's not, بس يعني usually there is a couple. حتى احنا زي ما ranking into center احنا we rank كمان university يعني to be honest. بس ما يمنع أخذنا من different university, أخذنا من جامعات برا الرياض أساسا. it's not, بالعكس يعني في جامعات حتى جديدة وبادية وفي مناطق مختلفة في المملكة وأخذنا منهم وكانوا excellent بصراحة. فما هو سبب يعني. وزي ما قلت أنتوا أحيانا تخربوا على بعض, فانتبهوا يعني كل جروب لما تتخرجوا كذا قولوا لهم ده الموضوع.
تمام إن شاء الله. يعني حاجة, something a lot of people are questioning is whether the interviews this year are going to be on site or online. So I don't know if that has been decided or not.
لا أتوقع majority يعني 90% will send you an email. طبعا مو بس أتكلم على كينج فيصل, أتوقع الجميع. بس كلنا I think we want to do it physical. خلاص we want to see you guys. It's just it's nice الأونلاين يمكن للناس اللي برا, بس we want to do it physical. We want it's a different صراحة, totally different يعني not في الانترفيو. فالحمد لله everything is better, الأمور أحسن صارت, فأتوقع الحمد لله.
تمام إن شاء الله. Now, regarding the recommendation letters and how many can someone put in in their application, or how much would you recommend basically for them to submit?
يعني whatever they have 5 10 it's okay. بس أنا زي ما قلت لكم إنه تكون الكواليتي حقتها يعني حطوا اللي عندكم. don't يعني go with a specific number. بس بالذات لما تكون الكونتنت حقتها حلو. بس don't add 30 مثلا وكلها يعني it doesn't mean anything. تمام. from 5 to 10 it's acceptable بصراحة. و 5 يعني it's a good number.
تمام. We kind of already covered this, and I think it just applies to the same question we addressed earlier about the GPA. Someone else is asking whether it's the same for the SMLE, and regarding if there is a cutoff for acceptance or not.
لا ما أتوقع. بس لما نشوف discrepancy بنسأل أحيانا في الانترفيو why your GPA it was very high ولا SMLE it was low يعني what's happened to that يعني إنه usually بصراحة يعني عادة يكونوا equivalent قريبين من بعض ال GPA ولا SMLE يعني from a program directive point of view. فإنه usually when we see it like parallel to each other. لما يكون في gap either it was يعني they didn't prepare well for the exam or there's something. بس عادة it's another thing, as I said, it will add value.
All right, تمام. Now, when it comes to the dress code for females, what would you suggest for that regarding how to dress during the interviews?
Lab coat, it's fine, especially usually. If you're coming abroad, you're wearing your national abaya, that's okay. But usually it's better, يعني your physician, so coming with the lab coat وشيء رسمي. Not over makeup ولا إنه ده يعني عادي natural, like يعني you look at yourself in the mirror, see like you want to do that interview with in this shape, people you want them to take you serious كمان صح. Prepare yourself for in a very formal way.
All right. And do people have to write down their GPA in their CVs with SMLE grades, or is it fine if that's excluded يعني from the CV since they're going to be submitting those documents?
It's fine to be يعني it's better بصراحة. أنا أقول لك العام كانوا حاطينها it's very nice and that. فيمكن لا هذه يقول لك لا it's better to add it to the CV. Yeah. إنه هذا CV for the interview. So later on when you apply your CV for a conference or something different, you can remove those things. بس هذه أتوقع it's better to be added to your interview. Okay.
Okay.
And personally, I love it when I see you like you're designing your CV كذا وحاطينها. It's good.
Okay. تمام. And just I think this is the last question. But regarding أبناء وبنات المواطنات. فهل and what are their chances يعني of getting accepted, and are they treated يعني as differently يعني regarding citizens in terms of the acceptance?
Yeah, I think يعني they get in the matching or they get an acceptance يعني حتى في couple of center last year يعني. So I didn't see they're having any difficulty يعني. ما أفتكر عدى علي أحد بصراحة recently, بس couple of years ago before حتى I joined, I was like everything they're smooth their process, so they treat them like ما like Saudi, they're having priority ده, فما كان في إشكالية بصراحة. بس maybe also from center to center on how many seat to limited seat to that.
Okay, تمام. And the last question is, should a person include their hobbies and skills in their CV?
It's exactly. وبالذات إذا في skills يعني their hobbies, the skills, I love to say it to see it, sorry. And as I said, like حتى إذا في computer management skills, أشياء extra, يعني always it's reflect in your personality, الhobbies والهذه, فحلوة يعني it's an excellent. بس أشياء يعني مختصرة don't be exaggerated ولا زي ما قلت لك الفرنش هذه be aware يعني بالعكس أنا في ناس كنا يعني their hobbies very nice, they love reading, sports, أشياء computer skills, it's excellent. أنا for me يعني that's part of you who you are. That's it's nice to see it in the CV.
All right, تمام. There's a question from Razan. I didn't really get the question. If you would like to just unmute yourself, يعني no, and ask your question live.
Yes, hello.
Hello.
Just I want to ask about the link related to research as Google Scholar and ORCID link. Can I add it to my CV as contact information?
Yeah, you can, but Razan, يعني, we love to see the titles at least, the co-authors. So during the interview أحيانا I love to see it in the CV. بصراحة أنا أقول لك إياها يعني it's nice to add this. So majority of you did last year or the year before. بس they attach the research ترى لل PDF للpaper.
Yeah,
at least عرفتي يعني ما حد كم انتم 170 ما حد حيطلب كل واحد اللينك حقه طيب.
I wrote it search, but I mean in the contact information under my number, put to link, or this is make my CV it's يعني not professional. يعني زي يخرب منظر السي في as a link كده.
You can add it later on at the end, like as a part of بعد references you can add that يعني or under the research part when you're adding the research part you can add that link I think. And in the beginning it's your demographic or identifications you can add it, but maybe it's better to add it under the research so people they don't understand what is this they will see it.
يعطيك العافية دكتورة.
في courses كتير على السي في بصراحة يعني أنا just gonna mention this loudly يعني عادي أقول طيب الفيصل وجامعة ناشونال جارد يمكن هذول الاثنين يعني if you wanna cheat معاهم وتشوفوا معاهم cheat from their CV وتشوفوا معاهم إيش بيسووا their CV usually amazing بصراحة و couple of graduate from سعود كمان قريب يعني كانوا يعني بصراحة السي في حقتهم وفي جامعة قبل كم سنة يمكن المعرفة كمان يعني في أحياناً نحس إنه جروب someone teach them if you don't يعني ما عندكم أحد you have to ask someone to see your CV before you submit it. طيب someone expert إن كان عندكم في الجامعات society في جروب أنتوا تشتغلوا I'm sure يعني مها صح كلكم you've been through courses ولا شيء بالنسبة للCV ولا؟
هو optional there are courses usually I know about that.
فعادة يعني if you don't يعني ما كان عندك training ولا ما كان عندكم شيء ask someone to see and just give you a feedback before كيف شكله كله كده في النهاية قبل ما يسبمت.
Okay, that's great advice. And I think now this is the last question. And كل مرة يجي سؤال بعده. And when you say attach your research as a document, and you mean the manuscript, right? To know the publication. Okay. تمام. That concludes all of the questions. Do you have any last words or thoughts that you would like to share with everyone before concluding?
Just enjoy, celebrate هذا المومنت النجاح اللي انتم فيه كلكم انتم ما أعرف 170 plus applicant في Pediatric get matched so celebrate enjoy الويكند كله مع أهلكم أصدقائكم just spend a good time و prepare be confident وتوكلوا على الله سبحانه وتعالى قبل أي شيء I'm proud of all of you طيب whatever you worked with me or in another center you join us I'm proud and I'm happy you will be our colleagues إن شاء الله في المستقبل نفع الله بعلمكم يا رب.
الله يسعدك ويعطيك العافية دكتورة فادية. Thank you so much. We really appreciate your help and for all of the information يعني that you gave us. It was really beneficial.
Thank you.
شكرا لك.
يعطيك العافية.
Well, thank you everyone for attending. يعطيكم العافية.